A over consolidation, okay? And then the third one is called whispered pectoriloquy. Good word, huh? Pectoriloquy.
I'll spell that.
Hold on, I gotta find it. Whispered pectoriloquy. P-E-C-T-O-R. I-L-O-Q-U-Y. Pectoriloquy. Q-U-Y. Did I say Y? Okay. Pectoriloquy. So what you do is you have the patient whisper 1, 2, 3. So they should be saying 1, 2, 3, 1, 2, 3, 1, 2, 3. And it should be muffled. It sounds like, but it comes out clear with consolidation. Or clearer with consolidation. This goes back and forth also, from normal to abnormal. That's normal. That's abnormal. Yeah, not real clear, but can you hear the difference? So that's whispered pectoriloquy. Okay. You've got. Has anybody ever seen it? I've seen it maybe in the doctor's office. I don't think I've seen it in the hospital much. But you certainly could try it if you know your patient's got a pneumonia going on or something like that. Go ahead and listen so you can see if you can hear the difference. Okay, so that is...
All of those would be could be with pneumonia, all three of them.
Something with consolidation, something that would be... See, what's happening is, if the lungs are clear, then the voice is just traveling through nothing. So it sounds kind of... So, but if there's something there for the voice to travel through, like a pneumonia, then it comes through clear. Make sense?
Yes.
Sort of. How are we doing? Should we keep on going? Let's keep on going, and then after we get through the heart, then we can break up into do some practicing and listen back there. And I do want to sign you off on the IV drops too. Did we do that on Monday?
Yes, I did.
We practiced it. So I don't know
We
if
signed a
I don't think I
sheet.
signed everybody off last Thursday, but we will do it.
You signed a sheet with the second year students, so was that the time?
Oh, yeah, yes,
Okay.
I signed, yeah, okay. So, all right, I'm gonna leave the lungs and then we'll move into heart, okay? Unless anybody has any questions about what we've done so far. Okay. Shifting over to the heart and lungs. So, the heart, this is just another picture of heart and lungs, so I like that. And you can see the diaphragm and the great vessels and everything there. So what we're going to do is we're going to listen to the heart and listen to heart sounds, okay? Heart sounds. So when we talk about heart sounds, what we're listening to is the movement of blood as it's going through the heart. And the valves. Oh, I have a handout here. I'll keep that. Maybe, see if I have enough there. This is the one I was showing for the lungs. Is that better? Can you see that? Sort of.
Are we going to get that handout or no?
This one, no.
Okay.
That's, I just showed up there, I just wanted to. This one, so-so.
So-so.
So-so. Do I have enough of those? I hope. I might have to run outside and get it. I don't have enough, do I? No? All right. I'll make more copies of those.
We can share for
It's
now.
just showing the, okay. I'll give you a copy of this next week. Okay. I'll make more copies after we get through this, okay? This is just your little memory aid. I'll get to that part in a minute, but let me go back. So what we're listening to is the blood going through the heart and the valves. So when you're hearing the heart beat, we hear two distinct sounds, right? The lub-dub is one bum-bum, bum-bum. You with me? Yes? Okay. Lub-dub. So what we're actually hearing are the valves close. Okay. So when you hear that first heart sound, the lub, that's called S1. And that is associated with the tricuspid and the mitral valves. TM. Tricuspid and mitral valves. S1, lub. Okay? And then the second heart sound, dub, lub-dub, that is S2, and that's associated with the aortic and the pulmonic, thank you. So lub-dub, 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 pa-pum, pa-pum, pa-pum. So two distinct sounds that we hear with each heartbeat, okay? So when we listen to heart sounds, there's a specific area that you want to listen to hear each of those sounds, okay? And you're keying in on those valves. So you have to know your landmarks so you know where you're listening. And this ape to man is your memory aid to help you figure out what you're listening to in which area, okay? Ape to man. All right. No. You can't see this on the video, it's just a picture of ape to man and where you listen. Okay, so we'll start at the top. When we're listening, when you go to listen to heart sounds, start at the top. And this is the way we're going to do it, so maybe you've seen people do it differently, but this is the way I teach it, starting at the top and working our way down. It's another kind of almost S pattern. So we start with the A, going through our ape to man A, and A stands for the aortic area or the aortic valve, right? So to find this spot, you're going to go second intercostal space, right sternal border. Sternal border's important. Okay? Because pretty soon we'll talk about midclavicular, and there's other planes that we talk about. Sternal border. So second intercostal space, right sternal border. And when you put your stethoscope there, you're going to hear ba-bum, ba-bum. And S2 will be louder than S1 here, because you know aortic is associated with the S2, right? The lub-dub. So when you listen here, S2 will be louder than S1. Okay? Lub-dub, lub-dub. So that you'll hear that. Second intercostal space, right sternal border. Okay, A. So then, what's next? A, P, P. Okay, P, pulmonic. So now, that's the only one on the right of the sternum, by the way. So now we're going to go across the sternum, and we're going to go second intercostal space, left sternal border. So we know that is pulmonic, right? So in these spots, S2 will be louder than S1 when you're listening, okay? So let's see if that's true. Wait. There. You hear that? It's ba-bum. The accent's on the S2. Okay. And both of these spots. A, P. So if you know something's going on with the aortic valve or the pulmonic valve, now you know exactly where to listen to hear that. Okay. So going through our ape to man, A-P-E. E stands for Erb's point, E-R-B, Erb's point. This is like midway, I guess, in the heart. Equal sounds, certain murmurs you can detect here. That's all you need to know right now for herb. Okay, A-P-E, ape. So what's next? T. So we're on the left side of the sternum. We went second, third, now we're going to go down to four. Fourth intercostal space, left sternal border. So we're still right on the sternal edge there, the sternal border, right? So this is where you're going to listen for the tricuspid valve. And you know that's associated with S1. So S1 is louder than S2 here. Still at the sternal border here. So you just come right down when you're listening. You go 1, oops, 2. Let me bring it down. Ah, hear that? S1's louder than S2 here. Okay. So that's the T. And then M for the mitral valve. Okay. So we stay at the fourth intercostal space, or you could move down to the fifth. Fourth or fifth, mid-clavicular line. Okay. Same exact spot that we talked about for the apical pulse. Left side of the sternum, 4 to 5 intercostal spaces down, mid-clavicular line, mitral valve. Okay. And that's where we count the apical pulse. What, Rebecca?
Well, when I do an apical, I only hear one beat.
You don't hear the bum-bum, the two distinct sounds? Or maybe you do, but now you're going to really hear them. We can practice. I'm going to have you practice on each other. One cardiac cycle is the lambda. That PQRST that you just had a test on, right? Didn't you? Mm-hmm. That's one cardiac cycle, where S1 is your TM, the tricuspid and mitral, systole, associated with systole, and then the aortic and pulmonic, diastole. Okay, so that S1, and I'm going to say this, but then I'll put it on the board, but I know on the video you'll be able to see it. S1 comes in right in the middle of the QRS wave. QRS, that's S1 in the middle of the QRS. And your S2 comes in after the T wave. Okay, you can picture that, right? This guy in the way here? No? Let's see. P, too low, right? Too much. Close enough, right? So that's S1 and there's S2. And then you have another PQRST. So that's one cardiac cycle. Can you see that okay? So that would be the normal, S1, S2. So sometimes somebody might have extra heart sounds, an S3 or an S4. Or gallops. They call them gallops because sometimes they sound like horse galloping, da-da-dun, da-da-dun, da-da-dun. So, extra heart sounds. Now, an S3 and an S4 are normal in children and young adults. Young adults. I don't know where the cutoff is.
Can you say that again?
S3 and S4, the extra heart sounds, normal in children and young adults. If they hear one in a child, I don't think they do anything about it and just keep their ears on it. And as they get older, they may send them to a cardiologist if it doesn't go away, but usually they're not worried about them in kids. Okay. Actually, another student was telling me how their child, who at the time was, I don't know, 10 or 11, and the pediatrician said, oh, you need to see a cardiologist. And when they went to the cardiologist said, why are you here? That's normal in a kid that age. So then they didn't worry about it. So an S3, okay, S3 is associated with ventricular problems. Like ventricular failure. And let's see, the S3 comes after the S2 on the on your EKG, and this is what it sounds like if you have an S3, okay? This is an S3 gallop, okay? They sound different. Hear that? Bum, ba-dum. That little rhythm. Okay? That's an S3 gallop. You don't have to memorize, oh gee, is that an S3 or is that an S4? At least not now. You may in the future sometime, but not now. So an S4 is associated with atrial problems, okay? And that comes after the P wave. And that has a little different beat. So here's, let's see if I can do this. I'll have to go see if you can hear it go back and forth. Ba-dum-bum. Okay, so that's a little different. 3, that's a 3. And that's a 4. Ba-dum-bum, ba-dum-bum. Okay, so that's a 3 and a 4. So on the EKG here, this is where your S3 would come in, right? After your S2, after the P wave, and your S4 would be after the P wave, S4, okay? After
If it's in EKG, it will show with different wave?
no,
No
it's
wave?
listening, you'll hear it.
Okay, but not on,
And then what they would do is, they probably send the patient for like an echocardiogram, because they want to check like the heart function. Are they pumping, are you getting good cardiac output? Because if they're symptomatic, then they're going to need to look further.
okay, so it just.
And if it's ventricular, like maybe with a little CHF, when the CHF is clearing, maybe with Lasix or whatever, it sounds back to normal. It can go back.
It doesn't show in EKG, but you can feel.
You'll hear it.
Okay.
You'll hear it before you see it, yeah. Because that's what'll make you follow up, okay? Extra heart sounds, S3, S4. Okay, hang in there. Only had a couple more things. Murmurs. Murmurs occur when there's turbulent blood flow through the heart. Excuse me. when there's turbulent blood flow through the heart, or great vessels, okay? And what you hear is that swishing, blowing sound, shh, 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 okay? So if, for example, there's some sort of defect in one of the valves, so that valve isn't closing tight, then you have a little bit of backflow. So instead of it closing tight, some blood leaks going this way up and down. Then it'll cause that like a swishing. You still hear lub-dub, but you hear that swishing blowing in there as well. Okay? Or it could be a septal defect where the blood is going right, left, this way. So murmurs are graded on a scale of 1 to 6, where 1 is very minor and barely audible, all the way up through 6, which is the loudest. And they say in the books that if someone has a grade 6 murmur, you don't even need to put your stethoscope on the chest, you just hover it over the chest and you can hear it. That's a bad one. And again, you'll probably see symptoms if they're that bad. Where if their valves are leaking and they're not getting proper circulation going through the heart, maybe they're short of breath, they're getting that backup of blood. So maybe they get really short of breath with activity. If they've got some valve problems, this is the person that goes to see the cardiac surgeon for valve replacements. That's open heart surgery. And you know, murmurs will vary in pattern. Some you know, loud, like crescendo, and some are systolic, some are diastolic. I don't get into all of that. If you want to get more of that, you can read it, of course, read it in the book. I personally am not going to test you on that. What I want you to know is the normals, so when you hear these things, you'll know it's not normal, and maybe you won't know right away what it is, but you'll know to report it and follow up. Okay? So I do have a couple murmurs here. Let's see which ones we got. So if you're reading in the chart that your patient has an aortic stenosis, aortic valve, where do I hear the aortic valve? So you're going to know exactly where to go to hear that. Okay? We do have an aortic regurgitation. That's what this one has. Let's see. Let's see what it sounds like. Is that I know, a lot of these sounds are like, what? How am I going to know what that is? You know? Pulmonary stenosis is this one. See, they're going to sound a little bit different. Well, pulmonic. That's not any different. There it is. Pulmonic stenosis. Okay. Well, I think you get the idea, right? Okay, we'll leave that one. So murmurs. So bruit, you've heard that term, right? B-R-U-I-T, bruit.
B-R-U-I-T.
Yes. B-R-U-I-T. Bruit, yeah. What that is indicative of is, again, an abnormal blood flow. And you'll see docs, or maybe you'll do it at some point in time, listening on the side of the neck. Okay, what they're listening for is that bruit in the carotid artery. So if you hear a bruit, that means turbulence in the carotid artery. So what could that be due to? A blockage, plaque buildup. Mm-hmm. So they do ultrasounds of the carotid arteries, and that can actually say, 90% blockage of the right carotid artery. So it can tell you, just like that, how much. And what's the risk here? What are they at risk for? Stroke, because the carotids feed the brain, right? So if it's a complete occlusion, they won't get the blood flow to the brain, or if a piece of plaque maybe breaks off and goes up, floats to the brain, then same thing. So maybe this is the person who's having TIA symptoms, which brings them to the doctor, and then they see that they have the plaque buildup here. But it's listening over the carotid artery for that bruit, which is that swishing, blowing. Then they would see a vascular surgeon, and we have one at CMH, at least one. Don't we have two? Anybody know? Do you know? I don't know, but I know there's somebody there. And they do the carotid endarterectomy, which is the cleaning out of the carotids. Okay. They usually do one side at a time. Yep, so look for those patients. Carotid endarterectomy, I don't really know how to spell it, you'll have to just sound it out. Just like it's carotid endarterectomy. And then there's one more piece of this, and then we'll take a breath. Checking for JVD, or jugular vein distension. Okay, jugular vein distension. So you're going to want to put your patient in semi-Fowlers and just have him turn his head away from you. And basically what you're doing is looking for bulging neck veins. Okay? You're looking, they should be flat. You shouldn't see any bulges of the veins bulging out the side of the neck. If you see bulging neck veins, that could be a sign of heart failure, circulatory overload. Something's wrong. Okay? And again, as you pick up on different things like that, or maybe you're hearing those crackles, you may be seeing other symptoms as well. Okay?
In the field, we watch for the GDD, we actually watch for the trachea to move.
You watch for the trachea to move with
Shift.
the tracheal shift? So, and what's that telling you?
Usually pulmonary embolism.
A pulmonary embolism?
Yeah.
So when do you have them do this? Or just,
Usually
or you're
about a
basic, you're just looking for
All of a sudden, I've seen it like twice in the field.
a
Where I actually
tracheal
watch
shift.
the trachea move from one side to the other, and that means that there's usually air or something including
Something pushing.
Yeah,
Pneumo?
pneumo, or even if there
Just
is
something
plaque or
like-
something where it's
Really
bulging.
blocked,
Yeah.
that might push everything over.
Mhm.
So you might look for, make sure the
Yes,
trachea is
like
midline.
Yeah,
So trachea should be midline. So if trachea is deviated off to one side, not good. You have to figure out what's going on. So you might not even, they may not even be awake for that, or gasping for breath. Okay. All right, so that's 8 to man, heart sounds. Yeah, take 5 and then come on, or 10, and then stretch. Come on back, and then we'll break up, and we're gonna just listen to the sounds, listen to the mannequin, and do a little practicing, so. Cut.